Vimal Mehta from ERA Clinic, and I'm going to be talking about how to prevent viral fever. So, viral fever, if you have ever been diagnosed with viral fever, you may be wondering if it is possible to avoid it. This talk is going to focus on the causes, the symptoms, treatment of viral fever. It also explains how to prevent it. Fortunately, there's a simple cure and a lot you can do yourself to prevent it. Read on to learn more. Here are some things to keep in mind. The symptoms. Basically, this video is going to be about the symptoms of viral fever. The term viral fever covers a wide spectrum of viral infections that result in high body temperatures. The person will experience a generalized body ache, while others may experience a rash or other symptoms, offering specific organs, affecting specific organs. The symptoms of viral fever are not predictable and vary from person to person. Although they may include, generally, they are body ache, running nose, cough, and common cold. Infections are common and spread widely, but there is no non cure for a viral fever. Vulnerable individuals are at risk for contracting viral fever through direct contact with their bodily fluids. This simple explanation explains how the virus spreads. When infected, the individuals spray their fluids with bacteria or viruses. It spreads from person to person. This may occur via the mouth or nose, and it takes 16 to 48 hours for an infection to develop. Once infected, you should seek medical attention immediately. Unlike bacterial infections, viral fever usually lasts for a short period of time. The classical symptoms of viral fever include fever, chills, sore throat, nasal congestion, and runny nose. Some people may also experience muscle or joint aches. Usually, viral fever symptoms will subside on their own within 3 to 7 days, though some people they may persist for weeks or months. However, you should not try to medicate with medication as it can make the condition worse. While a fever and the accompanying symptoms are common, the disease is not dangerous. In most cases, it will disappear on its own. However, you should still consult a medical professional if you have any unusual symptoms, as while as your fever continues for more than 2 days. If you have any questions or are concerned about your health, visit the family doctor. The best way to treat viral fever is to get the right diagnosis. It's important to stay away from people with low immunity as this type of illness is contagious. Viral fever is caused by one or more severe illnesses, several viruses that are commonly carried by the air or water. You can catch viral fever by being in close contact with an infected person. Sometimes you may also contact the virus just by breathing in the air. When an infected person coughs, droplets of the virus float into the air. It is important to see your doctor if you suspect you are suffering from viral fever. So, those are the symptoms of viral fever. Now, we go on to the next uh, heading, that is basically the causes of viral fever. Why does the viral fever, what causes it? Viral fever is caused by bacteria or viruses that are spread through contact with bodily fluids or infected people. The infection is spread by the infected person's droplets, which can enter a healthy person's mouth or nose. The full infection process takes approximately 16 to 48 hours. Other causes of viral fever include mosquito bites, blood transfusions, needle prick injuries, and air droplets from the infected persons. A person can contact viral fever by sharing food, water, or skin with an infected person. The virus is also spread by contact with bodily fluids during sexual activity. Insect bites and contaminated water can also be the source of viral fever. Viruses are transmitted through the bites of mosquitoes and the saliva of infected people. If you are in contact with an infected person, you should make sure you wash your hands thoroughly. Besides hand washing, you should also eat warm, fresh fluids and drink lots of water to prevent dehydration. Treatments for viral fever are antibiotics are not an option. If the fever persists or is high, antibiotics only reduce the size of the virus by eliminating harmful bacteria and viruses. Antibiotics can harm the gut lining, kill good flora, and damage the liver and kidneys. Therefore, you should always visit a doctor if your fever is high for your own safety. It is best to eat a warm meal and change your clothes after visiting the doctor. The best way to prevent a viral fever is to practice hygiene. Avoid touching infected people as this can spread the infection. To prevent catching a viral infection, you should wash your hands frequently and wear a face mask. Using hand sanitizers and disinfectants may also help. Taking antibiotics can actually make your condition worse. Always remember that prevention is better than cure, and you should be cautious when sharing personal belongings. Taking an antibiotic can cause a bacterial superinfection. So, viruses cause viral fever. Most cases will clear up on their own in a day or two. However, there are some instances where medical treatment is required. If your fever is above 103 degree Fahrenheit, you should consult a doctor and make sure you stay hydrated. You should also seek medical attention if you think you have a virus infection. If you're unsure, you can get some information on viral fever remedies. So, we go to the next heading, that is the treatment of viral fever. The treatment of viral fever varies depending on the type of viruses that has infected the body. Non-steroidal anti-inflammatory drugs such as ibuprofen and acetaminophen may help the patient reduce fever and decrease body ache. Antibiotics are prescribed if the fever is persistent and a secondary infection develops. However, if the condition is worsening and may cause side effects such as nausea and stomach upset, then you can avoid it. It is important to seek medical advice if you are suffering from this condition. If you are experiencing a high fever of 104 degree Fahrenheit or above, you should seek medical attention as the fever is serious and may lead to secondary infections. Generally, viral fever is self-limiting and goes away as the virus cycle ends. However, it is if your symptoms are persisting for more than 3 days, you should see a doctor. The best treatment for viral fever varies depending on the type of virus and the severity of the symptoms. In some cases, lukewarm baths can help alleviate the diarrhea. Electrolyte solutions can be taken for fatigue. For severe cases, a doctor should prescribe antivirals and other medications. These medicines may also help reduce fever, relieve diarrhea, ease diarrhea. Most viral fevers resolve on their own, but some can become fatal. Besides the fever, viral infection can also lead to serious complications. Some viral infections can result in pneumonia, severe joint pain, or skin rash. Other viruses can damage the nervous system and cause a variety of disease. This infection is spread by insects and could be treated with care. If these symptoms do not go away within a few days, see a doctor for a more appropriate diagnosis. Symptoms of viral fever include severe joint pain, rash, facial swelling, and vomiting. A doctor will examine the symptoms to rule out other conditions and determine the proper course of treatment. Blood tests may be necessary to distinguish between viral and bacterial infections. Some patients can even become hemorrhagic if they don't receive treatment. If you don't seek medical attention for viral fever, don't despair. There are plenty of treatments available for viral fever that are safe, effective, and affordable. Prevention. How do you prevent viral fever? The most important part of prevention of viral fever is avoiding contact with sick people. You should wash your hands before eating and after coming inside from the outside. This is because our hands come in contact with many surfaces that can harbor viruses. Hand sanitizers can also help protect us in situations where we don't have access to soap or water. Prevention of viral fever can make a difference in the quality of your life and the quality of your bath. In addition to washing your hands regularly, you should also make sure that you do not touch the face or nose. Always dispose of used tissue in a proper manner. Another important factor in preventing viral fever is to keep your home clean and mosquito free. Fortunately, avoiding contact with sick people is not as difficult as you think. Prevention of viral fever can be as simple as cleaning your house and taking a few simple steps. And remember, your immune system is what will keep you healthy. You can take preventive measures against viral fever by eating warm foods, avoid using antibacterial drugs unless you are sure you're suffering from the disease. Keep your body temperature above 37 degrees Celsius to relieve viral development. If fever is too high, change your clothes immediately. After visiting the hospital, you should also avoid self medication with antibiotics and prevent any bacterial infections from occurring in the first place. However, if you have an undiagnosed viral fever, seek medical attention right away. To prevent a viral fever, you should practice a good prevention method. First, you should know the signs of viral fever. A high body temperature means you're experiencing a viral infection. A shivering, sweating, or hot skin will likely be a sign of fever. A flushed face and a glassy eye are other indicators that you're experiencing a viral infection. Your body may also experience muscle and joint aches. Viral fevers usually go away within a week or two, but it can be more serious and lead to various complications. A doctor's visit may be necessary and you'll be prescribed over the counter medicines to relieve the symptoms. The symptoms of viral fever generally last between 3 to 4 days depending on the virus, your age, and your health. You should also avoid antibiotics if possible, as these can make the condition worse. Uh, well, this was in short about viral fever, and I hope you had a productive session. If you have any questions, you can always ask me down below. Thank you.